Just so you know, we're going to record today's meeting. So greetings, everyone. My name is Heather McDonald-Stonecker, and I'm a Government Project Officer in the Center for Substance Abuse Prevention. I'm with the Division of Primary Prevention. And today I have the distinct honor of serving as the facilitator for our Strategic Prevention Framework Partnership for Success new grantee orientation. And this is for our communities and tribes. So I just want to welcome everyone and say congratulations on receiving your award. And before we get started, I would just like to share that all attendees have entered in the webinar in listen-only mode. The question and answer box can be used to submit a question to the presenters and panelists. So please feel free to use this feature as we go through the presentation. There is time allotted at the end of the presentation to answer questions submitted. Grantees will receive a PDF copy of the PowerPoint presentation, as well as the recording at a later date. Over the next 2 hours, we will discuss the purpose and program requirements for the PFS grant program. We will discuss ways to address participant protection concerns, learn best practices for the management and post-award administration of the grant, take a quick dive into SAMHSA's reporting system, receive an overview of technical assistance providers, and we will round out the session with a discussion on the Disparity Impact Statement. During the presentation, again, please feel free to put your questions in the question and answer box so you remember what they are. The goal for today's orientation is to provide you with a strong foundation along with the knowledge and resources to successfully manage your new CSAP grant award. Before we get into all of the logistics and technicalities of the program, I would like to turn the presentation over to the Director for the Center for Substance Abuse Prevention, Captain Christopher Jones, for a welcome message and opening remarks.
Thank you very much, Heather. And really, thanks to everybody for joining today. We have almost 100 folks on. And again, on behalf of SAMHSA and the Center for Substance Abuse Prevention, welcome and congratulations on your PFS award. This is one of our most competitive programs. We had hundreds more applications than we could fund, which I think speaks to the strength of your applications, but really speaks to the need for continued investments and resources to support prevention in communities. We know that there are many communities who are ready for action, yet don't have the resources to do it. And you all will be leading the charge as you get this work underway on your end. And I love the community level prevention work that gets supported by this program. That is really where the action happens. So much of changing norms in communities, building resilience, engaging with people across a lifespan to change that dynamic in communities is really the essence of prevention and where we can see such tremendous impact and realize those impacts and benefits of prevention so upfront and personal in your own backyards. So really appreciate the work that you are doing and the work you will do under the funding over the next several years from SAMHSA. And today you're going to hear a lot of stuff. I love the first question that always pops up. Will the slides be shared? Heather has already said yes, as well as the recording. But I appreciate, that you're going to try to take it all in, but also know that this is just the beginning of a conversation and the beginning of our journey together, that we are here to support you and to help you make the biggest impact that you can make in your community over the lifespan of this award. So whether it's your project officers, it's other folks in CSAP, TA providers, other parts of the SAMHSA family, we are here to walk with you on this journey and to support your work. And please hold us to account for that because you are really doing the work. Our job is to help facilitate it and support it. So once again, thank you. Welcome. I really look forward to hearing about the innovations and successes and impact that you're going to have and look forward to our continued conversations over the next 5 years. So again, thanks very much for joining us today, and I'll turn it back to Heather.
Thank you so much, Captain Jones, for your welcome remarks and introduction. So when we talk about SAMHSA's vision for the future, we're talking about a future where individuals, families, and communities are healthy and thriving, And our mission is to provide leadership and collaborate across sectors to advance prevention across the lifespan, which is the work we're doing with our communities. And then our aim is to prevent initiation, progression, and to prevent and reduce the harms all associated with substance use. And how do we do it? We do it through the use of data, prevention science, communication, collaboration, and strategic program investments such as the PFS program. The Strategic Prevention Framework Partnership for Success, or PFS, as we like to call it, it's overseen by a two-person team. So you'll have on your notice of award, you'll have your grants management specialist, or the GMS, and the GMS oversees the day-to-day business and other non-programmatic aspects of the grant. And then you'll also be working closely with your government project officer, or GPO. Again, that's on your notice of award on the under number 10 on the left-hand side of that first page. And the GPO serves as the program point of contact and oversees the programmatic and technical aspects of the grants. And as Captain Jones said, we are here to support and assist anytime you need it and for whatever your needs might be. So your government project officers are part of the Division of Primary Prevention. And if you'll look on the screen, these are our current GPOs. So Pierre, Clark, Tiona, Michelle, Charlotte, Kamisha, Jackie, Kabai, and Laura. And then Lucretia, Kimmy, Lauren, myself, Lisa, Marette, Mary, and Tia. And this brings us to an overview of the fiscal year 2024 Strategic Prevention Framework Partnership for Success Grant Program for Communities and Tribes. So the overall purpose of this grant program is to help reduce the onset and progression of substance misuse and its related problems by supporting the development and delivery of community-based substance misuse prevention and mental health promotion services. The 24 PFS program is grounded in the Strategic Prevention Framework, or the SPIF, which is a community engagement model grounded in public health principles, including being data-driven and focused on providing evidence-based services to underserved communities. The program is intended to expand and strengthen the capacity of local community prevention providers to implement evidence-based prevention programs. Grantees are to use local, state, and national substance use public health data to identify prevention priorities in their communities and develop and implement strategies to prevent the misuse of substances. They are also asked to utilize a data-driven approach to identify underserved communities and subpopulations of focus. The Strategic Prevention Framework Partnership for Success program is authorized under Section 516 of the Public Health Services Act as amended. As I previously mentioned, this grant program is grounded in the SPIF. The SPIF is a 5-step planning process to guide states, territories, tribes, and communities in the selection, implementation, and evaluation of effective, culturally appropriate, and sustainable prevention activities. The SPIF process will assist grantees to use a data-driven approach to identify underserved communities and their populations of focus. So now that we have a high-level understanding of the purpose of the grant program, we want to share some quick highlights of the PFS-24 Communities and Tribes grantees and the grant program. For fiscal year 2024, we have awarded 41 grantees that cover 28 states, 1 territory, and DC. Additionally, we awarded 3 federally recognized tribes. The project start date for FY 2024 was September 30th, 2024, and the project period is 5 years. For a complete list of award recipients, we encourage grantees to visit SAMHSA's website, and there is a link in the slides. On the website, community and tribal recipients will also be able to view a list of the states that were awarded in fiscal year 2024. So you'll be able to connect, coordinate, and collaborate with state award recipients. Just when you're looking at it, make sure you look under fiscal year 24 because it will give you a pretty long list, and it includes also the 23s within that after the 24s. So be sure to look at that fiscal year 24. This grant program requires the hiring of 2 key personnel. Key personnel are staff members who must be part of the project regardless of whether they receive a salary or compensation from the project. The project director is responsible of oversight of the entire project, and the data analyst is responsible for the epidemiological data and program analysis. These staff members must make a substantial contribution to the execution of the project. Both positions are required to be at a minimum of 50% level of effort. Any changes to these positions require prior approval by SAMHSA after review of staff credentials and job descriptions. And please note that the project director and data analyst cannot be the same person. Both positions require prior approval by SAMHSA staff after reviewing credentials and job descriptions. And if you had a project director and or data analyst within your application, you should be receiving a note through ERA correspondence, an email through ERA correspondence from your assigned government project officer stating approval. So if in ERA correspondence, your project, your PI or PD is someone other than you may want to check to see if they received that email. Because when we send email through ERA correspondence, it goes to whoever is assigned as the PI, PD, and your business official and signing official. So if you haven't received that email and you're not identified with an ERA, you might want to check with who is listed on the NOA as the PI or the PD. The Notice of Funding Opportunity outlines the required activities for the grant. Required activities are activities that every award recipient must implement. Grantees are to use the Strategic Prevention Framework, or the SPIF, to address their data-driven community substance misuse and mental health promotion priorities. Using the SPIF as a foundation, the NOFO provides a timeline for the required activities in the following increments: 45 days, 90 days, and 180 days. Within the first 45 days, we ask the grantee to implement activities around communication and coordination with other prevention providers in the community and at the state level. These activities include identifying points of contact with the SPIF PFS state recipients, if applicable, and working in conjunction with the SPIF PFS community and tribe recipients to establish a plan for regular communication and engagement to ensure the coordination of efforts, address gaps in prevention, improve networking relationships, and promote partnerships within and across communities. Within the first 90 days, grantees are required to begin implementing assessment activities, including assessing, collecting, and identifying data sources and gaps in the data specific to the prevention landscape in the community. Other required activities include using up-to-date public health data, identifying substance use concerns that are having negative consequences in the community, including identifying subpopulations that may be at greater risk and or underserved by existing prevention services. Within the first 180 days, the required activities center around capacity and include connecting and engaging with the Prevention Technology Transfer Center, or the PTTC, which you'll hear about a little bit later, and developing and strengthening prevention resources, which may include a variety of community members and stakeholders who are well positioned to deliver substance misuse prevention and mental health promotion services. Required activities under planning include developing an implementation plan to reduce risk factors and enhance protective factors in the community, and establishing processes to continually review and revise the plan, making it an adaptable living document that can respond to changes occurring during an implementation. And this is also within the 180-day timeline. All grantees are required to begin implementing prevention services within the first 6 months of the program. Additionally, grantees are also required to institute regular engagement with the SPIF PFS state award recipients, if applicable, as well as community partners during implementation to ensure supports are in place to help ensure success and make needed adjustments given changing landscapes. We also want to continually begin delivering prevention services and monitor those as we are implementing. And we want to look for that process data as well as outcome data later. Lastly, within the first 180 days, grantees are required to start evaluation-focused activities, such as establishing impact measures tied to the original problem that they plan to address that can be monitored on an annual basis. Ensure that your goals and objectives are reflective of the intended outcomes described for your community, and establish impact measures and share those results with statewide award recipients and other community stakeholders to build upon successes and promote solutions for challenges. Allowable activities are allowable use of grant funds, but are not required. Allowable activities may include identifying and collaborating with entities serving the selected communities and underserved populations, such as substance use disorder treatment providers, recovery community organizations, local harm reduction coalitions, emergency medical service agencies, such as 988 and local crisis call centers, Department of Justice, child protective agencies, mental health agencies, and organizations serving at-risk youth. Now let's take some time to discuss the data collection and project performance assessment requirements. At the core, all SAMHSA recipients are required to collect and report certain data so that SAMHSA can meet its obligations under the Government Performance and Results Modernization Act of 2010, or GPRA. To further understand the purpose of reporting, we look at the reporting requirement through 3 lenses. The first lens is program monitoring. The grantees should be using the data they collect to monitor and adjust their program throughout the life of their grant. Data collection and reporting can be used to answer the question, are we having a positive impact on the community? The second lens is program-wide impact assessment. CSAP and SAMHSA use data collected from PFS grantees to assess the program-wide impact of PFS. These data help us answer the question, what is the result of the investment in the PFS program as a whole? Documentation and compliance is the third lens we use. We are looking to see if the grantees are using the funds appropriately. We also use these data to understand what came out of SAMHSA's investment in PFS and if there are lessons that can be learned for future prevention programming. Recipients are required to report performance, including the following measures: number of people served and reached by IOM categories, such as universal, selected, and indicated, 6 strategies, and demographic group. Over the next couple of slides, we will dive further into the data collection and performance measure requirements. In addition to the measures mentioned on the previous screen, the required reporting includes 5 additional components, starting with the annual targets. The annual targets include community prevention message and outreach, along with individual and small group prevention services. Grantees will coordinate with their GPO to set targets each year for the number of individuals they plan to reach with community prevention outreach activities and how many individuals they plan to serve with more intensive prevention services. These data will feed into the quarterly inputs. Grantees will report each quarter on their progress toward their annual targets. The report is due within 30 days of the end of each quarter in SPARS. Earlier in the presentation, I mentioned that grantees are to establish impact measures tied to the original problem that they plan to address that can be monitored on an annual basis. This is the foundation for the impact reporting model. For this model, the grantee will identify up to 3 community-level prevention priorities to address. For each priority, the recipients will need to develop an impact reporting measure which links the program or activity inputs to community-level impact. At a minimum, the reporting model must include the following for each priority area. The first variable is the intervening variable, risk factor reduction. Examples include survey data measuring the knowledge, attitudes, and perceptions of the target audience the program is planning to reach. The second variable is the intervening variable, protective factor promotion. Examples include survey and other data tracking uptake or increases in protective factors, such as participation in after-school activities and family communications. The third variable is the consumption or behavior variable. This could be survey data measuring the actual behavior of the target audience. For example, a survey may measure past 30-day usage of a particular substance. And the last variable for the annual impact report is the consequence variable. This includes survey data or data from external data sources showing the impact at a community level, including substance use-related crime, hospitalizations, accidents, or school discipline. Let's take a moment to conceptualize what these variables look like in action. We use a schematic to show how the community goes from input to impact. For this example, we have a community-based organization that works with young adults at high risk for alcohol use. This organization provides a series of interventions offered in school and out of school. The input variable for this community-based organization are those evidence-based practices used in interventions. The young adults that participate in the program complete a baseline and post-intervention survey to measure their perceived risk or attitudes toward alcohol use. When analyzing these surveys, the community-based organization notices that the participants' understanding of the perceived risk of alcohol use improves over time. To understand if the participants are turning this knowledge into action, the community-based organization distributes a past 30-day usage survey, and they find that over time, the rates of consumption declines. Next, the organization explores the outcome indicator where they track if the reduction in consumption is having a positive impact at the community level through reduced crime, hospitalizations, accidents, or school discipline. For this example, the community-based organization found that school disciplinary actions related to alcohol use declined as a result of the program, which is their community impacts. This concludes the program overview section of our orientation. I will now turn it over to Lieutenant Kawana Cohen-Hopkins for a discussion on participant protections.
Thank you. Good afternoon, everyone. My name is Lieutenant Kawana Cohen-Hopkins, and I serve as the Division of Primary Prevention Participant Protection Officer. In the next few slides, I'll highlight the key aspects of participant protection as it relates to policy compliance and the process of satisfying the requirements of your SAMHSA grant. Next slide, please. So first, I'd like to talk about participant protection governance. When we focus on human research, the overarching perspective is to ensure we protect the rights, welfare, and well-being of research participants. While we're not doing academic research, our grantees are still responsible for ensuring their program participants are protected. The key regulations for us are listed here. It's 45 CFR 46, 42 CFR Part 2, the Code of Federal Regulations, and the 7 participant protection guidelines, which I will highlight in the next slide. The one also listed here, which we're all familiar with in the field of public health, is called HIPAA, the Health Insurance Portability and Accountability Act. So let me touch on a few aspects of those regulations. So highlighting 45 CFR 46 and 42 CFR Part 2, excuse me, there are 2 points I would like to emphasize. First, the regulations reflect human participant research that is conducted or supported by a federal department or agency. So second, human participant research not directly conducted by a federal agency and is administered through an agency, institution, coalition requiring governance and approval by an institutional review board. So in both situations, the research involves human participants. For SAMHSA, our focus regarding the regulations presents as a grant program, which you all are familiar, which may have research involving the use of educational tests, survey procedures, interview procedures, or observations of public behavior. So research involving the collection or study of existing data, documents, records, pathological specimens, or diagnostic specimens are additional examples that we want to focus on. So now regarding HIPAA, we focus on the main point of privacy and confidentiality. As many of us may be aware, the privacy rule standards address the use and disclosure of individuals' health detail, usually referred to as protected health information, or PHI, and serves as a standard for individuals' privacy rights to understand and control how their health information is being used. At HHS, the Office for Civil Rights, also known as OCR, has the responsibility for enforcing and ensuring adherence to the privacy rule. So based on the noted regulations on this slide, we here at DPP emphasize adherence because federal funds administered by the department or agency may not be used for research involving human participants unless the requirements of a human research policy have been satisfied. So in this case, SAMHSA's participant protection guidelines that your organization will respond to within the special terms and conditions within your grant satisfy these requirements. So again, please keep in mind that all grantees are held to the same governance standards, regardless of your project. So if you all are here, you've been awarded a grant, so you all are responsible for adhering or addressing the participant protection concern section under the terms and conditions. Now, if you've done that already in your application and we did not follow up with you, you're good to go. But in some cases, those participant protection concerns were not addressed. And so we sent out additional information to individual grantees asking for them to address those concerns by October 31st. Next slide, please. So I'll take a moment to go through each of the 7 elements under the participant protection guidelines. So SAMHSA has participant protection requirements because it is important to have safeguards protecting individuals from risk associated with their participation in SAMHSA projects. So as part of the grant process, like I said, all grantees, including those who plan on obtaining institutional review board approval, must address all of the elements listed. So if some elements are not applicable to the proposed project, grantees still have to provide a detailed explanation as to why the element is not applicable. So you can't just put NA. All right, so be sure to check your notice of award to see if you have a participant protection concern, which are listed under the special terms and conditions section. Again, this is part of the application process. If we did not see that these guidelines were addressed within your application and you received an award, we will reach out to you and it will be listed within your special terms and conditions section of your notice of award. Okay, and again, a number of grantees have spoken with either myself or Candice Griffin over the past 2 weeks. So if we've been in communication with you about those concerns or you've addressed them and we had some follow-up questions, we've already done that. But we're looking for all the concerns to be addressed no later than October 31st. So first, I'll take a moment to go through each of the participant protection guidelines. So first, we are looking for you to discuss how you protect clients and staff from potential risk. So this is where we want you to identify and describe any foreseeable risk that you may have on working or participating in the program, and then provide some guidance and assistance in the event there's an adverse effect that may occur to either the community or staff working on this grant. Okay. Next, we want to ensure a fair selection of participants. So in this section, you want to describe the populations of focus and explain the reasons for selecting or not selecting a certain group. Some, as an example, some grantees may be located in rural areas or big cities. Either way, take into consideration the demographics of your population when describing why certain populations were selected for participation in your program. Third, absence of coercion. So in this section, we want you to explain if participation is voluntary or required. And this element is also where you would specifically address if there's any compensation offered to the participant. So if you are giving gift cards, stipends for transportation, or pizza for participants, we want to hear about it here under section 3. Number 4, data collection. So in this section, please identify your source of data and the data collection procedures in detail. So try to think about how important it would be to know the details of a study where you or a loved one's personal health information was being collected. So are you collecting data via a survey that was created? Will your project be using electronic survey links? Is it paper copy? Was the survey link or documentation submitted for review to the Institutional Review Board? We want to hear about those details. And then we'd also like to know if there's a partner agency collecting the data for your projects. And if so, if a memorandum of agreement or understanding is established with that partner agency. Remember here in this one, the details really do matter. So do your best to give us as much information as possible. Number 5, privacy and confidentiality. This is something that we get a lot. So we want you to describe the parameters that your organization has put in place to ensure that the data you collect will remain confidential. So tell us a little bit about where the data will be stored. Is it on a password protected computer? Who has access to those computers and to that password? And then how will the identities of the participants be protected? Okay. Adequate consent procedures. So let's think about the use of appropriate consent forms here, especially in the case of minors. Okay. If you are working with a population that includes children, anyone under the age of 18, please don't be surprised if we ask for additional layers of protection for those populations. So if you are collecting data or if your program has teenagers, grade schoolers, middle schoolers in the program, we would like to see the details of how you are gaining consent from their parent or guardians. And then we'd also like to see a copy of that consent form. So please be sure to include that in your response to these terms and conditions. And then last but not least, a risk-benefit discussion. So this is where you want to discuss risk in comparison to benefits. So sort of a pros and cons or risk-benefit list that may be useful in responding to this last element. If you find that creating a list or chart is helpful, please feel free to do that in your response if that makes it easier. Okay. Next slide. And so what I wanted to do is just provide you with an example of what you may find under that terms and conditions section if you have a participant concern. So in this example, the grantee has been asked to provide information under the privacy and confidentiality guidelines. So this was element number 5. So to respond, the grantee would develop an answer that would highlight what parameters their organization has put in place to ensure that the data that's been collected will remain confidential. Like I said, where is it being stored? Is it password protected? Who has access to that information? And then how will the identities of the participants be kept confidential? So that concludes my section on participant protection guidelines and concerns. I'll be here towards the end, so if you have any questions, please feel free to drop them in the Q&A and I'll answer as quickly as possible. But if you find that you have some follow-up questions later, my email address is listed here. Please feel free to reach out to me. Thank you so much, Heather. Back to you.
All right, thank you so much, Kawana, for that overview on participant protections. Unfortunately, our GMS, Erwin Morales, was not able to join us today. I will be reviewing the portion of this presentation, but he did ask me to let the group know that if you have any questions or need clarification regarding fiscal matters, budget concerns, terms and conditions, and your notice of award, like budget revisions that may have been placed in there, to please reach out to him directly and he will be happy to assist you. If, as we go through this section, if you do have questions, please be sure to put that in the Q&A along with your contact information if you're comfortable with that. This way, we can just forward those questions with your contact information directly to Erwin, and he can reach out to you and get those answered. So I will do my best. I am by far a program person. Fiscal and budget is not my area of expertise. It definitely is Erwin's, so I will attempt to do his presentation justice. But if not, he's happy to help you in any way and assist and support you in the fiscal management of the grant. So in the agenda today, we're going to talk about roles and responsibilities, ERA Commons. We're going to take a look at a notice of award, discuss post-award amendments, the federal financial report. We're going to look at some key due dates. He also put in some really good recipient grant management tips and resources. So when we talk about roles and responsibilities, first, the recipient. So the recipient is the grantee, and they are also known as the federal grant recipient. And this is the organization awarded a grant or cooperative agreement by SAMHSA. The grantee is legally responsible and accountable to SAMHSA for the performance and financial aspects of grant-supported projects or activities. The signing official or the authorized organizational representative, so the SO or the AOR, is the designated representative of the applicant or grant recipient organization with the authority to act on the organization's behalf in matters related to the award and its administration. In signing a grant application, the SO or the AOR agrees that the organization will assume the obligations imposed by applicable federal statutes and regulations and other terms and conditions of the award, including any assurances, if a grantee is awarded. The responsibilities include accountability both for the appropriate use of funds awarded and the performance of the grant-supported project or activities as specified in the approved application. This is the official point of contact for the award. And on your notice of award, as you'll see, that person is listed. So double check your NOA and make sure that that's correct. We talked about key personnel earlier. So the project director is responsible for that technical or programmatic aspects of the grant, in addition to the day-to-day management of the project or program. The PD is usually an employee of the grant recipient. And the data analyst, they are responsible for the epidemiological data and program analysis of the grant program. And this position can be employed of the grant recipient or a contractor. Just remember, both are at a level of effort of 50%, and they cannot be the same person. So they have to, the program director and data analyst are required to be different individuals. In addition to that, the SO, AOR, and the PD must also be two different individuals. Key responsibilities of a recipient include, but are not limited to, ensure compliance with the terms and conditions of the award, implementing the approved activities in the award, cash management, so things like payment and expenditures and disallowed cost, records retention. We must maintain adequate financial operation and programmatic records, reporting for the federal financial reports, the FFR, and progress reports by the due dates included in the NOA, and we will talk specifically about that in a few slides. Suspension and debarment. So you need to check the SAM to verify vendors are not federally debarred and or suspended. Failure to comply with grants management and award requirements can result in drawdown restrictions or other restrictive special conditions. So the Grants Management Officer, or the GMO, is responsible for the business management aspects of grants and cooperative agreements, including review, negotiation, award, and administration. The GMO is also responsible for the interpretation of grants administration policies and provisions. The Grants Management Specialist, or the GMS, is responsible for overseeing day-to-day business and other non-programmatic aspects of the grant. These activities include, but are not limited to, evaluating applications for administrative content and compliance with statutes, regulations, and guidelines, negotiating grants, providing consultation and technical assistance to grantees, and administering grants after award. A little bit about ERA Commons. So NIH's Electronic Research Administration, or ERA, is the official electronic grant system for SAMHSA grants. Things to note: be mindful of any electronic correspondence coming from ERA, and make sure the program director and project director, known as the PD, are registered in ERA Commons. And here are different links, guides, and videos, depending on what you may need to do in ERA. So examples of when you might need to contact the ERA service desk. And this includes ERA Commons, including Assist, ERA Commons registration, ERA errors, warnings, and technical assistance, such as when you're trying to submit a post-award amendment or responding to your terms and conditions in your notice of award, uploading the federal financial report. Any change in the business or signing official on the grant record, it's important that those changes are made so they have the valid credentials when trying to submit some of your post-award amendments, especially. And then you can contact the ERA service desk for technical questions. And there's resources and information below to do that. So let's take a look at the notice of award. So the notice of award is the authorizing and official award document for SAMHSA. It is the responsibility of the recipient to read the notice of award in its entirety. This award is governed by Uniform Guidance 2 Code of Federal Regulations as codified by HHS at 45 CFR 75. The Department of Health and Human Services Grants Policy Statement, standard terms and conditions for the fiscal year in which the grant was originally awarded, SAMHSA additional directives, and the SPIF PFS Community Tribes Notice of Funding Opportunity. By drawing federal funds from their award, recipients agree to abide by all applicable laws, regulations, program requirements, policies, terms, and conditions. The recipient is responsible for carrying out approved project activities. Recipients may only charge to the grant allowable cost resulting from obligation incurred during the budget period. Recipients may not obligate grant funds for project activities after the budget period has ended. So the difference between project and budget periods. The project period is the total time SAMHSA has programmatically approved a federal project for federal support. This does not constitute a commitment by the federal government to fund the entire project period. Each budget period within the project period is subject to the availability of funds and satisfactory progress of the project or program. Budget periods usually are 12 months long. However, shorter or longer budget periods may be established for programmatic or administrative reasons. The notice of the award, or NOA, will show the total approved budget for the applicable budget period. So if you look in your NOA, you'll see this is one example. It'll have your project period listed. So in this case, 9/30/2024 to 9/29/2029, and the total award amount over the life cycle of this grant, which is this PFS grant is a 5-year grant. But then it has a breakdown by budget period. So then you'll see the each budget period listed here. the amount for each budget period, and the dates for each budget period. Section 1 of the NOA is award data, and this provides information on the amount of the award for the stated budget period, the award recipient, and any applicable program-specific legislation and regulations. This award includes award calculation, summary totals for all years, and accounting information. Section 2 is about payment and hotline information. So payments under this award will be made available through the HHS Payment Management System, or PMS. And then here's a list of resources for the PMS system. And again, you'll receive a PDF of these slides, and these links will be usable within the PDF of the slides. PMS best practices. Recipients may request reimbursement payment on an as-needed basis. Requests can be made daily, weekly, monthly, etc. Federal funds must be expended within 3 business days. Recipients must return any funds not spent within 3 business days. Recipients should not be holding excess cash. So federal funds drawn from PMS, again, must be expended within 3 business days for costs that have not been incurred by the recipient. So an example of this is for payroll costs. If payroll comes out on a Friday, however, the recipient has insufficient funding to pay grant-supported personnel costs, the recipient would draw down funds 3 business days, so on Tuesday, prior to payroll date to ensure that funds are expended within the appropriate time frame. And effective April 1st, 2022, the Department of Health and Human Services grant recipients will no longer be required to complete the quarterly federal cash transaction report. Please be sure to review the additional information provided at PMS FCTR updates at the link provided. And please note, these changes do not impact the standard reporting requirements and deadlines for federal expenditure data submitted in the Federal Financial Report, or the FFR, or SF-425, as required by your Notice of Award. Section 3 is standard terms and conditions. So it provides order of precedence that explains the laws and regulations that govern the award. Recipients are responsible for understanding and complying with the rules and regulations in this section. Failure to comply with these guidelines may result in enforcement actions up to and including termination of the award. Section 4 there's special remarks such as special terms. So one example for the PFS-24 is the Disparity Impact Statement, and it will have a due date, and also your funding limitations and restrictions. And then there also might be some special considerations. So your grant might need to do a revised detailed budget with a narrative. As Kawana mentioned earlier, you could have some participant protection concerns. There might be a marginal or unacceptable rating that needs to be addressed, indirect cost agreements, and so on. But if those are not listed in your specific NOA, then it is not something you have to worry about. And then there are also the standard terms for awards. Please be advised recipients must submit required documents via ERA Commons Terms Tracker. We talk about special terms such as funding limitations and restrictions. SAMHSA reserves the right to disallow costs under this grant award at any time during the award project period. Award recipients are responsible for ensuring that costs allocated to the grant are reasonable and allowable in accordance with the NOFO under Appendix I, which is standard funding restrictions and all applicable policies and regulations. The funding limitation restrictions for this project are as follows. No more than 20% of the total award for the budget period may be used for data collection, performance measures, and performance assessments. SAMHSA recipients must also comply with SAMHSA's standard funding restrictions, which are included in Appendix I, standard funding restrictions. And again, those are in the NOFO. And if your GPO has not, they will be sending out some guidelines, and they put the NOFO in with that if you need reference, but it's also at samhsa.gov under the grants management section. You can also get the NOFO for your award as a reference. Okay. Next, are unallowable cost. So recipients must exercise proper stewardship over federal funds and ensure that costs charged to awards are allowable, allocable, reasonable, necessary, and consistently applied regardless of the source of funds according to the factors affecting allowable costs and reasonable costs. Allowable costs, unless otherwise authorized by program statute, are necessary and reasonable for award performance and allowable under the cost principles. The cost principles that delineate the allowable and unallowable expenditures for HHS recipients are described in the 45 CFR Statute 75 Subpart E. Allocable costs can be charged to a federal award if the goods or services are in accordance with relative benefits received. Reasonable cost is an amount within acceptable range. Costs are not in excess of what would normally be incurred for the effort given market rates, effort, and the organization's documented policies. Post-award amendments. So key examples of where a post-award amendment is required for SAMHSA's approval are a budget revision, change of key personnel, change in scope, no cost extension, merger, successor in interest or transfer, organizational change, or formal carryover or prior approval. All award amendment requests must be submitted through ERA comments. And then there are some resources on post-award amendment guidance, how to submit a post-award amendment request. And then only an amended NOA signed by the GMO is considered valid. Verbal authorization is not an approval and is not binding on SAMHSA. So when should you submit a formal prior approval for a budget revision? Reallocation of funds within a budget period that exceeds 25% of the approved total budget or $250,000, whichever is less, and a reallocation of funds to unapproved cost categories. How should a budget revision be requested? It should be requested via ERA, and request is reviewed by the government project officer and grants management specialist. So what should you include in the request? You should have a signed cover letter on the organization's letterhead with a justification for the request. So you want to explain and support the need for the budget revision, including a detailed explanation of what costs are being rebudgeted. Include a statement of assurance that there will be no changes to the approved award objective, goals, or purposes, which would require approval for a change in scope. You should have the budget narrative, and you need to use the SAMHSA budget template to expedite the review. And then you'll have your SF-424A and SF-424. Change of key personnel. So when should you request a key personnel change? Replacement of key personnel, separation from the project for more than 3 months, or a 25% reduction in the level of effort for any key personnel. How should key personnel amendments be requested? Again, through ERA, and it's reviewed by the GPO and the GMS. You want to include in your cover. You want to include in your cover letter. Again, organizational letterhead with the justification for the request, the position, the level of effort, the salary, the commons ID for the project director, the specific budget statement regarding budget threshold, and also the effective start date of the key personnel. You want to make sure you have a copy of the resume of the key staff position for the potential candidate, and you want to have a copy of the job description. Again, the SF-424 with box 4 and A PD information, and box 21 with your signing official, and then the SF-424A. Federal financial reports, and be sure to review your NOA for standard terms and conditions for due dates. please see FFR submission due dates below. The FFR for the first budget period is due no later than 90 days after each budget period. At the end of the project period, the final FFR is due as part of the grant award closeouts. And then there are instructions for closeouts, but that won't be happening for a while. The FFR should reflect cumulative amounts. Ways to submit are through the payment management system. And there's a link for resource for instructions on how to submit. And the user must be logged into PMS to access that link. Or ERA Commons FFR module by clicking Manage FFR button on the Search for Federal Financial Report page. If you have questions about how to set up a PMS account for your organization, please contact the PMS help desk at the email provided or at the number provided. Okay. And here are some tips for recipients. Communication. All grant-related requests must be submitted through ERA Commons. When contacting SAMHSA, please ensure the grant award number is listed in the subject line of the email. The AOR, SO, and the PD for the award are the only persons authorized to make requests or speak with SAMHSA personnel. The PD or AOR or SO can provide written authorization for additional personnel to speak with SAMHSA personnel. Contact your assigned GPO for programmatic questions and contact your assigned GMS for financial and administrative questions. For budget, to expedite the review of requests requiring a detailed budget, it's highly recommended that you use SAMHSA's budget template version 2.0, which can be accessed at this link or on samhsa.gov under grants management. Budget narrative justification provides sufficient narrative to explain how each cost relates to achievement of the goals and objectives of the grant and provide calculations, detailed breakdowns of the materials, quantities, number of persons, cost per unit hour, number of hours, levels of effort, or other relevant basis to explain how each of the budgeted amounts were determined. So here are some key due dates. So when you look at your special terms and conditions, you want to look at the NOA for things such as the Disparity Impact Statement. So that has a specific due date. And then any of your other things such as I want to mention, some of you might have participant protection revisions to make, and they're asking that those are done by the end of October. So just double check your NOA for those special terms and conditions and adhere to the due dates within that. For your federal financial report, again, it's 90 days after the end of the budget period. So your first one will be due December 29th, 2025. And that will be in PMS or ERA Commons FFR module. And I'm sorry, for the special terms and conditions listed in your NOA, you're going to submit that in ERA Terms Tracker. And then he's also provided a list of resources for different concerns or issues that you may have. And again, these links will be in the PDF of the slideshow that will be sent out. And then also who should you contact for certain things? And you guys can see that. And I always say, as a government project officer, if you're not sure, you can start with us as your point of contact. And we can, if it's not us, then we can point you in the right direction. Okay. Now, Shannon Von Dross with the Office of Prevention Innovation, or OPI, will provide a review of reporting for the SPIF PFS-24 for communities and tribes. So Shannon, I'm going to send it over to you.
Thank you, Heather. Hi, everyone. My name is Shannon Von Dross. I'm with the Office of Prevention Innovation here at CSAP. And like she said, today I'll be giving an overview of your data reporting requirements, some of which we have already touched on today. Next slide, please. So today I will cover the Programmatic Progress Report, including your annual impact reporting, the CSAP online reporting tool or CORT, which includes your annual outcomes data, the required work plans, our data reporting system SPARS, and any relevant reporting due dates. Next slide. And first, we'll start out with the Programmatic Progress Report, or PPR. Recipients must periodically review their performance data to assess their progress and use this information to improve the management of the project. The project performance assessment allows recipients to determine whether their goals, objectives, and outcomes are being achieved and if changes are needing to be made to the project. The annual Programmatic Progress Report, or PPR, must be submitted to ERA Commons within 90 days of the end of each budget period. The report must include reporting period activities, accomplishments, and progress toward achieving program goals and objectives, evaluation updates and outcomes, including your annual impact reporting or outcomes data, planned activities for the upcoming reporting period, as well as any changes experienced and mitigation strategies implemented. A template for completing the PPR will be provided. Next slide. As previously mentioned, you'll report on the impact of your program annually using surveys and external data sources in an impact reporting model. This will be submitted as part of your PPR and must include, at a minimum, the following for each priority area. 1, an intervening variable for risk factor reduction, for example, perception of parental or peer disapproval of substance use. 2, an intervening variable for protective factor promotion, for example, participation in after-school activities. 3, a consumption or behavior variable. An example of this would be past 30-day use of a particular substance or set of substances. And 4, a consequence variable, for example, substance use-related traffic accidents. Next slide. Your annual impact reporting, often called annual outcomes data, will be submitted annually as part of your PPR and should include data collected during the budget period. During year 1 of your grant, we also ask that you submit baseline annual outcomes data with your PPR. The baseline data will ideally reflect data collected from the federal fiscal year prior to grant funding. When reporting your outcomes data, please include any relevant information about your data, including but not limited to the data source, any population parameters, including the age or grade level of your participants, a valid N, and anything else you feel may be important for us to know in order to understand the data reported. Next slide. Next, we'll discuss the CSAP online reporting tool, or CORT. Next slide. The CORT consists of 3 main parts: the annual targets report, quarterly performance reports, and work plans. The annual targets report are where you will set goals for the reporting period, which is the federal fiscal year. Goals will include proposed prevention strategies to be implemented, as well as the estimated numbers of people you plan to serve or reach through your grant activities. The annual targets report for year 1 of your grant will be due on April 30th, 2025, and on October 31st for each grant year thereafter. In the quarterly performance reports, you will report on progress toward meeting the goals you outlined in your annual targets report. You will report which prevention strategies you implemented, as well as actual numbers served and reached, and provide a brief narrative summary of grant progress, successes, challenges, and innovations. Quarterly performance reports are to be submitted to SPARS within 30 days of the end of each federal fiscal quarter. The CORT is still making its way through the government approval process, or OMB, and we anticipate its approval in November. While it is still in the OMB process, we will provide a draft copy of these measures for your planning purposes. Although unlikely, there is a small chance that the measures will change slightly from the draft to the final approved version. Next slide. As I mentioned, the goals set forth in the annual targets report will directly relate to the performance measures you reported in the quarterly performance report. For example, in the HER, you will report how many individuals you plan to reach, whereas in the QPR, you will report on how many individuals you actually reached during the reporting period. Next slide. There are 4 work plans required for this program. The assessment uses data to define the nature and extent of substance abuse problems, identifies affected populations, and identifies underlying causal factors that lead to consumption patterns. The implementation plan will outline what prevention strategies you intend to implement to reduce risk factors and enhance protective factors for substance misuse problems impacting the population of focus. The evaluation plan will describe how your prevention strategies will be assessed and establish outcome or impact measures tied to the original problem that your grant program plans to address. Finally, the strategic plan is a written document that includes assessment results, identification of prevention priorities, strategies to be implemented, and sustainability plans for the program. Your project officer can provide more information on what should be included in each of these work plans. Next slide. And next, I'll provide a brief introduction to our data reporting system, SPARS. SPARS is SAMHSA's performance accountability and reporting system. It is the online platform or website that we use to collect grantee progress and performance information, including information that we need to fulfill the requirements of the Government Performance Results Act, or GPRA, and the GPRA Modernization Act of 2010. Your court data, including the annual targets reports, quarterly performance reports, and work plans, will be submitted using the SPARS system. The data you submit through SPARS allows SAMHSA to report on key outcome measures and will be reported to the public as part of SAMHSA's congressional budget justification. Next slide. SPARS accounts will be created automatically for project directors. Project directors will receive an email from the SPARS system when their accounts are ready. We anticipate that SPARS access will be granted to our project directors in November. From there, project directors may complete an add or remove SPARS users form in order to request SPARS access for additional program staff. Next slide, please. This is what your dashboard will look like within the CSAP area of SPARS. The top portion of the screen shows your quarterly performance reports, and the bottom portion of the screen is where you will submit your annual targets report and any work plans such as the strategic plan and evaluation plan. If you hover over the cog on the right of your report or work plan, you'll see an action menu. From there, you can edit, export to PDF, submit to your project officer, or view the status history of your report or work plan. Next slide. SPARS will also house resources to aid you in data collection, reporting, and using the SPARS system. This will include a copy of the court, a question-by-question guide, as well as training videos. These resources are still in development at this time, but we will share them with you as soon as they are available. We will also be hosting trainings and office hours related to SPARS in the court in the coming months to help answer any questions you may have ahead of your data submissions. Next slide. If you have any technical questions related to using the SPARS system, please reach out to the SPARS help desk either by phone or email. You'll see their contact information on the help tab of the SPARS website. If you have any questions about data collection or reporting tools, including the court, please reach out to me. If you have questions about grant implementation, please reach out to your GPO. And if you're not sure where to turn for help, your GPO can help point you in the right direction. Next slide. I know that's a lot of information in a really short amount of time, so the next slide just provides a really brief overview of everything I just discussed. Next slide. These are the reporting requirements that I just went over for your reference. It includes where each report should be submitted and when. As a reminder, your first QPR will be due on January 31st, 2025 for any activities completed during FY25 quarter 1. Next slide. With that, I want to say thank you so much for your time today and congratulations again on your grant award. If you have any questions about SPARS or the reporting requirements we discussed today, please feel free to submit your questions to the Q&A.
Thank you so much, Shannon, and the Office of Prevention Innovation for all of your hard work on all of the reporting requirements and help keep us all straight on that due dates and what's due when and where. So now Ingrid Donato, again with the Office of Prevention Innovation, will be reviewing the amazing technical assistance resources available to you.
Thank you so much, Heather, and a big thank you to Shannon for going through the data. Hi, everyone. My name is Ingrid Donato. I am the Director of the Office of Prevention Innovation here in CSAP. We are a newish office. We just celebrated our 2-year anniversary a couple months ago. And as you can probably gather from our roles in today's presentations, all things data and technical assistance are housed within our shop. So I'm very thrilled to be able to spend a little time with you and share some resources. So unlike, I love my portion because I'm not telling you anything that you need to give us or anything that's due to us or any requirements. These are, I get to share with you resources that we have that we hope will support you in doing, rolling out the absolute best project that you will be doing. So I know there's going to be a Q&A at the end of this, but I did want to share because I know that there was a lot of information that Shannon went through. We will be having an additional training, a walkthrough for our PFS grantees on November 5th to go over the new data collection instruments. I know that is election day. We were scheduling a whole bunch of them at the last minute, and we're trying to get them in right after the FY24 Q4 reporting, and we wanted to get in as quickly as we could as soon as your new reporting periods were open up. Forgot it was election day. Not sure how I forgot that. So, but it will be recorded, but you should have either received an invitation or will be receiving one soon for a more detailed time where Shannon and I will run through the instruments and answer more questions on November 5th. There's one at 3 and there's one at 4. They will be recorded. The recording will be sent out to y'all, and we will have, as Shannon mentioned, lots of opportunities to spend more time with you to talk about your data reporting requirements. So before I get in to what I want to share with you about technical assistance, first, congratulations on your award. This is such an important grant program to CSAP, to SAMHSA, and I know to the nation. The work that you're going to be doing is incredibly important, and we are so grateful that you have taken this project on. So wanted to add to my congratulations to your award. But I also wanted to know if you can do either a thumbs up or a hands raised or anything. If you can let me know if you are returning, if this is your second PFS grant, or if you've received a CSAP grant before. All right, great. Oh, I'm seeing lots and lots of hand raised. Oh, I love that. I love the little horn with the things. That's great. Wow, there's so many of you. Fantastic. Oh, I'm absolutely thrilled to hear about that. So, now, do we have any new folks here? Or do we have any folks, maybe this is your first PFS grant? Okay, all right. Or maybe you're new to the program. Wow, so we have a real big mixed bag here of returning folks and new folks. So wonderful, wonderful, wonderful. Really, really glad to see the breakdown. So thanks so much for sharing that. So next slide, please. I'm going to start at the beginning with technical assistance. So let's start from the beginning for those of you that are new and might be doing that drinking from the fire hose of learning all the federal lingo that we throw around. But technical assistance, or TA, or sometimes we call it training and technical assistance, which is TTA, is really, just in a nutshell, the provision of expertise and support to help address a specific issue. It is used to build capacity within an organization and to ensure that your programs are as successful as possible. These are resources that are free of charge, that we've thought pulled together the expertise and the capacity to help with the different areas of the grants that you have. Next slide, please. So there are different ways TA can be used. As you're starting your program, you may want assistance with developing your logic models, identifying what evidence-based programs might be appropriate from, what your environmental scans and your needs assessments. They can help with any sort of strategic planning that you're doing, and your evaluation plan, any of your deliverables that are coming up, and you may be needing a little help with that. We have the capacity through our technical assistance and they partner with your project officers to help really get that expertise to you to get the information that you need. So we know that you are all extremely capable in doing the work that you have signed up to do, but we all know that every program, with no matter how many, the talented folks that you have, will run into some roadblocks and you'll run into some hiccups. And so please note that these technical assistance resources are there for you to help with it. So they're really to help build your capacity in whatever way that you might have. You might need some support in engaging new partners or doing some data collection. We know that sometimes we've been hearing a lot about how it's challenging to get into schools to do surveys or a variety of other things. They'll be able to help you with it in addition to your support now. So next slide, please. And there's a variety of ways that technical assistance can be delivered. They can do site visits, trainings, technical assistance, webinars, developing toolkits and fact sheets. And there's many technical assistance centers that SAMHSA has invested in across all of SAMHSA's priority areas. But CSAP has invested into 2 major technical assistance centers specifically designed to help with your work. The first one that I want to talk to you about is SAMHSA's Strategic Prevention Technical Assistance Center, or SPTAC. So for you returning folks, have you heard of SPTAC before? If you could do that same thumbs up, that would be great. Just let me know if this is an organization. Wonderful, wonderful, excellent. And I hope that you've had some success in working with them. I'm really thrilled to hear about that. So SPTAC is grantee focused. They've been specifically designed to help with the work of you, the grantees. The Strategic Prevention Technical Assistance Center, for those who may have been around for a while, is housed with a lot of staff from the old CAPT Technical Assistance Center, and they're really there to help with all of your grant-specific needs. We also rely on them for their work with their expertise around the strategic prevention framework. They have a deep bench in the SPIF model and can help you with each of the different phases of it. Next slide, please. Thank you. They have a regional approach. Like most of the work that we do here in SAMHSA, we are making it more regionally focused. So as you'll see there are specific technical assistance specific technical assistance providers who will be your go-to person. They are your frontline person that you will be interacting with. So you can take a note here, but of course we'll be sharing more information with you after the webinar as well. So they'll be more in tune with what's going on in your particular area, and we'll be able to help with that as well. And there's also a national coordinating group role to organize all the work that we're doing. Next slide, please. So the second technical assistance center that I want to share with you is called the Prevention Technology Transfer Centers, or the PTTCs. Again, if we could do another show of the thumbs up or the horn or whatever, have any of you heard of the PTTCs before? Excellent, wonderful. So I'm thrilled to see that you are hearing about these resources. We hope that you are using them because that's what they're there for. So the difference between SPTAC and PTTCs is that PTTCs are field focused. They're available for anyone who is interested to learning about anything related to prevention, substance use prevention. So where SPTAC is specifically for you, the grantees, specifically the CSAP grantees, PTTCs are more, they're available for anyone, and it's accessible, TA. You can go in there, you can peruse their resources that they have available. They have listservs, both TA centers do, but they have a listserv that I would highly recommend that you get on if you're not on it already. And they are our real go-to person for workforce prevention, workforce development. Okay. So as you're onboarding new staff, as you get new staff on, as you're building out your program, they have an array of resources that we think are very helpful to get folks up to speed. The prevention core competencies, as you'll see displayed here, is a set of 6 training modules that you can take on demand that really get you through the basics and the foundations of prevention. And there's thoughtful trainings that will help walk a person through the certified prevention specialist credentialing. You can also go onto their website, and there's an interactive map where you can click on and you can see the requirements right for credentialing right on there as well. A little bookmark there for you to share. Next slide, please. So as I mentioned, they develop lots of resources. So you can go there to look for fact sheets, for toolkits. They have archived webinars. If there's a topic, it's likely that you can go there and do a search and find something that that's helpful for you. Again, they are they have a really deep bench and a lot of resources around really supporting the prevention workforce. And they help harness a broad coalition, you should see prevention prevention organizations, so they can be thinking about what are those big picture topics that the prevention field is facing and start working on how to address it. So the PTTCs are similar to you, that they are they're cooperative agreements, and they just got their new awards as well. So previously they had a set of working groups that tackled some really high priority prevention topics like implementation science, cannabis, data-informed decisions, social justice, community coalitions, etc. And this next set of PTTC recipients will be doing something similar. We'll be sending more information out about the new wave of PTTCs. By and large, it's mostly the same providers, so you'll likely see a lot of continuity of care. But regardless, you will see whatever you need. You can anticipate that the services that the PTCCs provided previously, they will be doing again even better with their second set of grants. So next slide, please. Similarly, they are structured with a regional approach as well. So they have a national coordinating center, which manages the overall functioning and more national level work. And then, as you can see here, very specific regional supports to help you. So they're really tracking on the issues that are happening in the region. They will have webinar series that are reflective of the needs of the region, and a lot more of those specifics that might be appropriate for that. So we have, again, you'll be getting new maps out through your project officers and through the listservs as the new cohort gets up to speed as well. But they're still available. Lots of resources, and highly recommend you go ahead and take a peek at them. Sign up for those those listservs if you haven't already. Thanks so much. Next slide, please. But as I mentioned, SAMHSA issues an array of technical assistance resources. So I pulled a few here that I think might be of particular interest to you. We have the Evidence-Based Practices Resource Center. This will be a wonderful resource for you to go to really look about tools and resources related to understanding and selecting and implementing evidence-based programs that are reflective of the needs of the communities that you're going to be serving. The Suicide Prevention Resource Center, we know that the work that you're doing is substance use focused. However, we know that when you're in your communities, it's likely that you're addressing an array of issues that are, that are part and parcel. When we look at the risk and protective factors related to substance use, there's so many that are similar to suicide prevention, to array of outcomes that we're hoping to address. So you can find resources there. They have a Center of Excellence for LGBTQ plus behavioral health equity. We know that this is an important topic for many communities. And this is just a tiny little fraction of the resources that are available for you. If you go to samhsa.gov, you'll see a tab for practitioner resources. You'll see all of the technical assistance centers that are available. And these resources are available by and large free of charge. All right, next slide, please. I got a little ahead of myself. So as you see here, this is the samhsa.gov website. You'll see it's the second tab, practitioner training, and you'll see all those tiles there that you can click on to learn more about it. 988 has a specific technical assistance center. I know lots of you are working on 988 implementation in your communities and are tracking on 988 and built this into your work. Know that there's resources available as well. So again, for the full suite of all of the technical assistance resources that you have there, samhsa.gov, practitioner training, you'll be able to access there. We are working on improving this particular tab of the website to add search functions in that, and hopefully that's going to be launched hopefully within the next month or two, so which will make navigating this particular element of the website a little bit easier. Next slide, please. Great. And that's it for me, but please do know that we are here for you if you have any questions at all. If you'd like us to help connect you with resources, your project officer is your project officer is your first go-to person, but they know how to get in touch with us, and our door is always open as well. Thank you so much. And now I'll pass it back to Heather, who I think is going to pass it on to Martha.
Thank you so much, Ingrid. And we will now be joined by Martha Kent with the Office of Behavioral Health Equity. Martha, I'll turn it over to you.
Okay, thank you, Heather. Good afternoon, everyone, and congratulations on your award. Again, my name is Martha Kent, and I'm a public health analyst in the Office of Behavioral Health Equity. So today I'm going to talk to you about the Disparities Impact Statement. Next slide, please. So the Disparities Impact Statement, which we also refer to as the DIS, D-I-S, it is SAMHSA's data-driven quality improvement approach to advance equity in our grants. We use that DIS to identify underserved and historically under-resourced communities that are at the highest risk for experiencing behavioral health disparities. It gives grantees an opportunity to identify disparities in their communities and describe how they will use grant funds to address those disparities that they've identified. And it also prompts them to create a disparity reduction quality improvement plan that will support and allow them to sustain future outcomes. Next slide, please. So the DIS is derived from a 2011 HHS Disparities Actions Plan. It is the first secretarial priority of the plan was to heighten access and the impact of all HHS policies, programs, and processes and resources to reduce health disparities. In 2012, SAMHSA was the first HHS operating division to incorporate a health disparity impact statements into their notice of awards. We piloted it with 4 grant programs, and the success of that pilot led to us including the disparities impact statement in all of our grants starting in 2013. So the key takeaway from this slide is that SAMHSA pioneered addressing behavioral health disparities. Next slide, please. So this slide really helps us to illustrate why we really need to implement the Disparities Impact Statement. This slide illustrates grant enrollment demographics of 6 grants that are within our Center of Mental Health Services. The grants that are reflected here are our mental health block grants, our protection and advocacy for individuals with mental illness grants, our projects for assistance in transition from homeless grants, our children's mental health initiative grant, our certified community behavioral health clinic grants. We always call those CCBHCs, our government acronyms, so that's always a tongue twister. And then our TIEH grants, which are our treatment for individuals experiencing homelessness grants. As you can see by this slide, it shows that there is a disproportionate enrollment of individuals who are white than of other racial and ethnic minorities. Next slide, please. So the purpose of the Disparities Impact Statement is really to create greater inclusion among SAMHSA grants and to make sure that our grantees are identifying and developing a plan to address behavioral health disparities. Next slide. Thank you. So the Disparities Impact Statement, it is a term and condition of your notice of award. You should have received it in the notice of award, and it's due within 60 days of the start of the grant project. It would be submitted in ERA Commons as a PDF, and you are also required to update your progress on the addressing disparities at least annually. Next slide, please. So on this slide, going to talk about breaking the disparities impact statement into 3 components. So there are 3 sections of the disparities impact statement. So the first section asks you to identify behavioral health disparities. The second section asks grantees to identify how they will use the grant funds to address class standards and social determinants of health. And the final section is, now that you have identified these items, what's your plan? Next slide, please. So we're working on simplifying the disparities impact statement. And this is the document that we're hoping to have released soon, within the next couple of weeks. But in the meantime, if you're able and want to get started on your disparities impact statement, you are able to use the current resources that are available on our website. And the link to those resources will be at the end of this presentation as well. Next slide, please. So in this first section, grantees are asked to identify an underserved, unserved, or marginalized community that they would like to impact, and then discuss and document the behavioral health disparity that you wish to impact. Next slide. So when we talk about behavioral health disparities, what we mean is identify a gap that you would like to close. For example, maybe you'd like to close substance use prevention or substance use among American Indians or Alaskan Natives. You would basically say that that is the health disparity that you'd like to impact. Next slide, please. So in the next section of the disparities impact statement, there are 2 main tasks. And the first task in this section is to identify and describe how one or more social determinant of health will be addressed and improved, and identify how at least one class standard will be addressed or improved by the grant opportunity. Next slide, please. So what is a class standard? You can find the national class standards on HHS's website. There's also a link to those national class standards provided at the end of the presentation. Class standards are intended to advance health equity, improve health, and eliminate healthcare disparities. They work by establishing a blueprint for healthcare organizations to provide effective, equitable, and understandable, as well as respectful quality care. And there are 15 class standards, and you can choose at least one of them that you'd like to address with the funding opportunity. Next slide, please. So social determinants of health, again, you'd be asked to identify at least one social determinant of health. And social determinants of health are the conditions and environments where people are born, where they live, where they work, they play, they worship, they age, and then they thrive. There are 5 social determinants of health, which are economic stability, education and access, and quality, healthcare access and quality, neighborhood and built environments, and social and community context. So you would want to identify at least one of these SDOH domains that you'd like to address, but you could identify more than one. Next slide, please. So this last section of the disparities impact statement, it is the largest section. And in this section, you're asked to develop a disparity reduction quality improvement plan. So we ask grantees to specify what will be done to address those disparities that were previously identified, or close the gap that they would like to close. And then the grantee must propose how the progress will be measured, who is involved, and how the grantee will ensure that the changes are sustainable beyond the grant. The disparity reduction activity is basically an activity from your grant application. So if you're planning a listening session, or if you're planning to develop community partnerships, you would just want to make sure that you're developing listening sessions or community partnerships that are inclusive of people that may be underserved in your community. Next slide, please. So where applicable, we ask grantees to create a demographic table, and the table includes information from your application. And in that application, you would pretty much state who you would like to serve, broken down by race, ethnicity, sexual orientation, or gender, or who you propose to serve over the life of the grant. The next slide, please. So this slide is an example of the demographic table. And in the demographic table, our new update to the demographic table is to include reference data. So where applicable, if you're completing this demographic table, you would use the county health rankings and roadmaps, and we provided a link, which is also available. It'll show you how to quickly access that information and then add the percentage in the last column. Next slide. Thank you. So as I prepare to close, I want to restate the importance of the disparity impact statement. This slide is a screenshot of what we have these internal dashboards, and it depicts a FY21 combined enrollment, meaning who is enrolling in SAMHSA programs. And the demographics are for the Adult Treatment Drug Court and the Minority AIDS Initiative program. And both of these programs are from our Center for Substance Abuse Treatment, or in our Center of Substance Abuse Treatment. And what you can see from these two slides is that there's, again, disproportionate enrollment, as we have had 58.9% of the people enrolled were white and 69% of them were males. Next slide, please. So this slide shows the retention rate of two similar programs. And with this slide, you can see that this retention, we mean who's staying in our programs and who's completing our programs. And you can see that this is, again, very much similar to the other slide, where the highest rate of completion is among white males. Next slide, please. So the next two slides are a list of resources that are available on our website, as well as resources that are available to help identify disparities that may exist in your communities. Next slide, next slide. Thank you. So if you have any questions, I want to just say thank you and congratulations again. If you have any questions, feel free to put them in the chat. Thank you so much again for your time.
All right. Thank you so much, Martha, and everybody else, for our panelists with their expertise and helping us to create a strong foundation for the beginning of your PFS project and implementation. I hope everyone is still with us. I know it's been a lot of information in about an hour and 40 minutes, and it's the end of the day. So we appreciate everyone hanging in there. And so now that concludes the formal informational piece of our presentation. So I'd like to take the next 19 minutes, to leave for questions and answers. So I'm going to turn it over to Laura, and she is going to go through the question and answer section. And we have our branch chief, Fred Volpe, who's going to help answer those questions. But we also have some other expert leadership on the call that I'm sure are available to answer those questions as well. And just as a reminder, you will receive a copy of a PDF copy of the PowerPoint and a recording at a later date. So Laura, I'm going to turn it over to you.
Okay, great, thank you. So I'll start with the questions that are still open, and then I will read the questions that have received responses, just so everyone is aware of them. And I do believe the raise your hand feature has been enabled, so if anyone has a question to ask that way, feel free to do so. Okay, so the first question was posed during the GMS, the grants management section. So the question is, does that mean funds have to be returned within 3 business days, or funds not expended within 3 business days must be returned? And if the latter, then how quickly?
That's a really good question, Ava. That I don't have an answer to be honest with you. However, we're gonna check and see what we can find out. I wasn't aware that funds would be returned. I'm not familiar with a section that indicated that, but we're gonna check with our grants management leadership to get back to you on this. Anybody else know the answer to this? Heather? No. Okay, go on.
Okay, and then also another question, this is from Eva Zaret. So if she's listening and able to drop her email in the chat, we would appreciate
Right.
it. So we can ask Erwin to respond to your question. The next one is budget revision total budget, the budget for the project period or the budget period you're currently in?
Budget period you're currently in would be the answer to that.
Okay, great. And we just had a question come through that says, if we own the building we are providing the services in, can we charge an allocation of utilities in lieu of rental space?
Again, a question that you would ask your grants management specialist, and they would get back to you on the appropriateness of that.
Okay, great. And then while we're waiting for other questions to come in, I will just read off the questions that have been asked and responded to. Question asked if the copy of the slides and recordings will be provided, and that is yes. A question that was asked during the participant protection section was, for a youth program, obviously parental guardian consent is required. What is SAMHSA's stance on opt-out consent forms? Meaning you send the participation form home and require parents to return it if they do not want their child to participate. And Kawana had responded, opt-out consent forms are also accepted as long as they are accompanied by an opt-in form, or the opt-out option is part of a general consent form. Don't know if anyone has anything else to add for that. Okay, the next question was, is there a training how to use ERA Commons for new awardees? If yes, when? Jerry responded, please check the link for ERA related training videos and the links provided, which we will share with grantees after this webinar, along with the recording and slides. See, then there was a question asked during the reporting session. When will a copy of the measures be made available? Will they be made available soon? And Ingrid responded, yes, we are planning on sending them out shortly after this presentation. Please mark your calendar for the bigger orientation on November the 5th at 4 p.m. Eastern Standard Time, and that meeting will be recorded as well. And just checking the Q&A box, I don't see any new questions that have been submitted.
All right. Laura, I'll let you watch for hands raised because I can't see because I'm sharing screen. So it just kind of want to give one more opportunity for any questions to be put in the Q&A or to raise your hands. And I have, I think something popped into the Q&A.
Yes, we just got one more question. Is
Excellent.
there a SPARS training guide that will be sent along with the slides?
I believe there is, I believe the SPARS training is in some of the links in Shannon's piece. Shannon, was there the training resource, like, I think you covered that in yours, but I don't know if the link was there.
I can get a link for you. Right now, a lot of our SPARS resources are kind of under construction as we switch to the court, but we do have some more basic like SPARS website 101s that we can send right away along with a copy of the court.
Sorry, Fred, I stepped on your toes.
No, I was thinking of the MRT. Is that what you were thinking of?
Oh, the DSP MRT.
Yeah.
Yeah, we can send that. We can put that in the when we send out the slides.
Hey
Well,
guys, no.
No,
Let me just jump in.
okay,
Let me
see?
just jump in real quick.
Go ahead, Ingrid.
Yeah, so I was typing it in, and I'll just send this right now. So CSAP has made major changes to your data collection instrument. So for all of you former recipients that are getting new ones, are you in for a treat? Some of you may have attended the briefings that we held in April, where we demonstrated our plan on getting rid of many of the 120 fields that we make you respond to, and really streamlining it and collecting information that is only the information that we truly need, and to really reduce the burden on you pretty tremendously. We know that a lot of these reports that folks have been submitting in the past were up of several hundred pages long for our new approach and the new instruments. We're anticipating it'll be maybe 3 pages, 4 pages max. So real significant change in the level of burden, we hope, for you. And we're going to share. So that's why we're having a whole separate meeting for you all, so we can go through it in even greater detail. So as we're waiting for the instruments to go through final approvals, we're developing all of those resource documents for you. So nothing, we can send some information about how to get into SPARS and the technical pieces of it, but we're going to spend some time between now and January 31st walking you through the new approach and answering any questions that you have. So the DSP-MRT, gone, goodbye, no longer. Welcome the courts. The court's the new wave, and we're hoping you guys are going to love it. So, and many thanks. Some of you may have participated in cognitive testing of the instruments, or participated in the listening sessions that we had, or provided those comments through the public comment. We took all of those to heart, and have, fingers crossed, got something that's great for you guys. So thank you so much. Can't wait to share more.
Thank you for sharing more, Ingrid. If you can just hold on. We did have a question, just will the court take place of SPARS at some point moving forward?
So that's a great, I love that you asked that question, because SPARS and DSP-MRT and all that, it's so confusing. So SPARS is the platform. So SPARS is where you go to enter in the information, but courts, what used to be the DSP-MRT is now the court is the instrument. So those are the questions that we build into SPARS. So SPARS will probably never go away. It's SAMHSA's data platform that we use for all of our discretionaries. But when you go into SPARS and you're answering your questions, you're going to know it looks extremely different. So that's what we're changing. We're changing the questions that are in SPARS. So you'll still go to SPARS, you'll still answer all the questions in there, but you'll have far fewer of them. And you will have goals now too. So we have a couple new things for you, but they're important, and we think it's going to make everyone's lives easier. So excellent question. Thanks so much for asking it.
Thank you, Ingrid, for that additional information. The bottom line on this is that SPARS will be the place where we capture data and ultimately provide you, the grantees, with a much better profile and understanding, not only of what you're achieving, but how that stacks up with the rest of the world. It also will become the major informational capability to Congress, how we demonstrate to Congress the utility of this grant program. Therefore, your information and your outcomes are tremendously important to the future of the system. The other piece, the court itself streamlines the information that you'll be putting in quarterly that track your success, the work that you're doing in your individual programs. And trust me, this is a much, much better, more rational way of doing it than the way we have been doing it. And Ingrid and her group have done a just marvelous job of pulling all this together. So we owe her a great deal of thanks. And you do too, because your life is going to be a lot easier to track, follow, and report your important information to us with the help of our court. And Shannon Vandross, who led much of this effort, must be thanked as well.
Okay, another question, Ingrid, might need you back. What happens to the old SPARS data? Will we still have access to it?
Great question. Yes, but what it's going to look like, we're still sorting it out. So, it's such a big change, and CSAP is at the forefront of a SAMHSA-wide change. So we're working with SPARS right now to find out where that information will be archived. Obviously, you'll still need to have access to the information, and we're sorting that out. So we'll keep you posted once we've figured out what the capacity is for SPARS to have that, and won't let you hang in. Keep you hanging. But you might also, if for your current project, your current grantees or former ones, pop into SPARS, download those reports. You can download them as PDFs and make sure that you have them stored somewhere. For in case, who knows what comes up. So you have the capacity to do that right now, and I highly recommend that you do that.
I don't see any other questions for now.
So with the last couple minutes, I just want to give any, I know we've got Fred, Jerry, and Damaris on the call. Just give them a chance if there's any remarks or anything you guys would like to add. Just want to give you guys the opportunity to do so.
Well, I want to congratulate you on getting this grant. This is a very, as was brought to your attention earlier, this is a very important element of our primary prevention future. And we're very much devoted to supporting you. And you'll have many questions and many concerns along the way. Our project officers will get back to you and make sure that all your issues get resolved and attention gets placed on them.
Congratulations. We are so excited to have you, some of you return and some of you are new, a part of this cohort. For those of you who are returning, we're looking for your expertise as we do more of peer-to-peer sharing across the board. So again, congratulations, welcome. We're here to support you, to work with you, and just give us a holler when you have a question.
And I can say did all of that. So congratulations. We look forward to working with you.
Well, thank you again for all of our participants who hung in there. And this is all the time we have for today. And as Fred said, we encourage you to reach out to your GPOs and your GMSs with any questions or concerns that you have from A to Z. If we don't know, we will get you in the right direction. And again, thank you so much to our panelists for sharing your expertise. it's invaluable, and all the work that everyone here at CSAP and SAMHSA does to support each other and to support the work that you are doing or will be doing. And thank you to our grantees for the boots on the ground work and for making the impact within your communities. So with that being said, I'll give you 2 minutes back to your day, and appreciate your time, and look forward to all the community impact that you guys will be making. Thank you.